Imagine, if you will, that you own this incredibly delicate, like wildly expensive silk shirt. It's fragile, maybe, a little worn thin in
Oh,
places.
yeah, I know the kind you mean.
Right. Now imagine you have to iron that shirt using a blazing hot industrial iron, and you have to get all the wrinkles out without burning a single microscopic thread.
I mean, that sounds impossible. You'd probably just instantly ruin the shirt.
Exactly. You'd absolutely ruin it if you tried that in your laundry room.
Right, because you were dealing with this intense, highly localized heat on a material that has, well, almost zero tolerance for error.
But that microscopic balancing act, applying intense, potentially destructive heat to incredibly fragile material without actually destroying it, is the exact puzzle medical professionals are solving every single day inside the human body.
It really is.
And that is the mission of today's deep dive. We've got this fascinating stack of medical journals, clinical trials, and device patents in front of us, and every single one of them revolves around one highly specific, just incredibly consequential question.
It's a question that basically forces biologists, physicists, and mechanical engineers to all get in the same room and figure out a solution together.
Yeah, and the question we are exploring today is this. Let me just read it here. What temperature threshold limits are used during radiofrequency delivery to prevent subepithelial thermal necrosis in thin atrophic mucosa?
Quite the mouthful.
Right. Now, I know that sounds like a serious mouthful of medical jargon to you listening, but if you break it down, subepithelial thermal necrosis essentially means accidentally cooking and killing the tissue right beneath the surface layer of an organ.
Yeah, and thin atrophic mucosa just refers to the fragile, naturally moist inner lining of our internal organs when it has become thinned out over time.
Which happens naturally, right?
Oh, absolutely. Usually due to aging, hormonal shifts, or chronic conditions, it just, gets thinner and more vulnerable.
So why should you care about this highly specific medical tightrope? Well, whether you are looking into the latest anti-aging technology or, say, trying to find a non-surgical treatment for chronic acid reflux or exploring non-invasive gynecology, the entire future of medicine is
It
shifting.
really is. The traditional surgeon's scalpel is rapidly being replaced by perfectly controlled, invisible heat.
Which is wild. We are literally remodeling the human body from the inside out using radio waves. But to do that without causing a total catastrophe, the temperature control has to be flawless.
Flawless. And to really grasp how flawless it has to be, I think we need to look at the physical mechanism of radiofrequency, or RF therapy. Because when people hear heat therapy, they immediately picture, I don't know, pressing a hot piece of metal against the tissue.
Like a branding iron.
Exactly, like a branding iron, which is definitely not what is happening here.
Not at all, right?
Not at all. With RF therapy, the device itself doesn't actually get hot in the traditional sense. Instead, the machine passes a high-frequency alternating electrical current through the human tissue. We are typically talking about frequencies between zero point 0.3 megahertz and 1 megahertz. As that electromagnetic energy travels into the body, it forces the intracellular ions and water molecules in your tissue to oscillate rapidly.
So they're moving around.
Right. They flip back and forth, crashing into each other millions of times a second.
Okay, let's unpack this. We aren't applying heat to the body. We are basically using the body's own physical resistance to heat it up from within.
You nailed it. That resistance is called tissue impedance. The friction from all those molecules crashing together is what actually generates the heat internally.
Wow.
And the goal is to reach a very specific Goldilocks zone. If you look at the clinical studies we pulled on vulvovaginal rejuvenation and aesthetic dermatology, that perfect therapeutic window is between 40 degrees Celsius and 45 degrees Celsius.
That seems like a pretty narrow target. I mean, what happens magically at 40 to 45 degrees?
Yeah. Well, when you elevate the internal tissue to that exact range, you trigger a microinflammatory response. You aren't hot enough to destroy the cells, but you are just hot enough to cause a controlled stress event.
A controlled stress event.
Right. And this wakes up the body's fibroblasts.
It makes me think of like sounding the alarm in a firehouse when there isn't actually a fire.
Oh, that's a good way to look at it.
Yeah, you're basically tricking the firefighters into waking up, and since they're already awake, you just put them to work renovating the station. Are we essentially inducing a highly localized fever just to trick the body's healing cascade into kicking in?
That captures the mechanism perfectly. Once those fibroblasts are activated by that local fever, they stimulate two massive processes, neocollagenesis and neoelastogenesis.
Meaning new collagen and new elastin.
Exactly. The tissue starts synthesizing brand new collagen and elastin fibers. It denatures the old, loose collagen, which causes it to physically contract and tighten, and then builds a completely new, firm structural matrix.
Which is why it's so popular for anti-aging. And the sources also point out a massive advantage RF has over something like a cosmetic laser for this kind of internal work. Lasers use light energy, right?
They do, yeah.
Which means they can be absorbed differently depending on the color or pigmentation of the tissue.
Right, which introduces unpredictable variables.
Mm.
But radiofrequency energy is entirely colorblind.
Colorblind.
Yeah, it doesn't interact with melanin or pigmentation at all. RF relies purely on the moisture content and the electrical conductivity of the tissue.
Which makes it perfect for naturally moist, highly conductive areas of the body. The RF energy just glides through that hydrated tissue.
Exactly.
But if we follow the physics here, what happens when the tissue isn't healthy and hydrated? We established that the 40 to 45 degrees Celsius window is perfect for healthy tissue. But what if the area you need to treat is already compromised?
And this is where the physical limitations of the human body become a massive hurdle.
Okay, how so?
Well, in women's health, for example, there's a condition called genitourinary syndrome of menopause, or GSM. When estrogen levels naturally drop, the vaginal mucosa goes through profound structural changes.
So it changes fundamentally.
Right. It loses its natural moisture, it loses its elasticity, and most importantly for this procedure, it becomes incredibly thin and atrophic.
It basically becomes that fragile, worn-out silk shirt we talked about at the beginning.
That's exactly it. And working on that fragile material fundamentally changes the physics of the treatment. The biophysics data highlights a terrifying threshold known as the isotherm of irreversible tissue injury.
That sounds intense.
It is. For this kind of hyperthermic ablation, that line is drawn at exactly 50 degrees Celsius.
Meaning if the tissue hits 50 degrees, it just dies.
It permanently dies. If that delicate, thin mucosa reaches or exceeds 50 degrees Celsius, you induce thermal necrosis.
Thermal necrosis.
Yeah. The proteins break down, cell membranes literally rupture, and you have caused irreversible damage.
Okay, if you are listening to this, you are probably doing the math in your head right now. The line between miraculous regenerative healing at 45 degrees Celsius and catastrophic cell death at 50 degrees Celsius is just 5 degrees.
Just 5 degrees.
How on earth do doctors safely apply invisible radio waves to tissue that is already thinned out and fragile without instantly burning right through it? 5 degrees of leeway is nothing.
It sounds like a recipe for disaster, I know.
Yeah.
But the safeguard comes down to how thermodynamics actually work in biological tissue. Thermal damage isn't just a matter of keep temperature. It is calculated as a function of temperature over time.
Ah, so it's the difference between quickly touching a hot stove versus holding your hand on it.
Yes, perfect analogy. Let me give you an example from the research on treating female stress urinary incontinence, or SUI. Computer simulations demonstrate that you can successfully achieve thermal denaturation and tissue shrinkage at much higher temperatures if the exposure time is incredibly short.
Like, how high are we talking?
Well, they observed positive structural changes at 65 degrees Celsius, applied for exactly 30 seconds.
Wait, 65 degrees? But you just established that 50 degrees causes irreversible necrosis.
It does, if the heat is sustained.
Oh, I see.
But holding exactly 65 degrees for exactly 30 seconds requires a flawless split-second cutoff, which is really risky on thinned-out tissue.
Yeah, that sounds like a massive liability.
Exactly. So to keep that atrophic mucosa safe without relying on these high-wire timing stunts, standard non-ablative RF devices take a much more conservative route.
Okay.
Take the dynamic quadrupolar radiofrequency device, the DQRF. It strictly caps the target temperature at 42 degrees Celsius.
So they aim dead center in that 40 to 45 degree Goldilocks zone.
Right, and because they cap the target at 42 degrees Celsius, the practitioner can safely apply the RF energy using continuous circular movements for multi-minute sessions.
How long is a session?
We're talking up to 15 minutes per zone. Yeah, lowering the temperature and increasing the time guarantees a massive safety margin. Even if the machine fluctuates slightly, they are nowhere near that 50-degree isotherm of death.
Okay, that makes total sense. You lower the temp, you increase the time, you keep the device moving, and you stay safely away from the cliff edge of 50 degrees.
Exactly.
But here's where it gets really interesting, because the sources present a scenario where you actually have to cross that cliff edge.
Yes, they do.
What if a doctor needs to heat deeper tissues way past that 50-degree limit, but the only way to get the energy there is by passing it directly through that delicate, thin surface mucosa.
That represents the ultimate biophysical engineering challenge.
Yeah.
And it is the exact problem doctors face when treating severe gastroesophageal reflux disease, or GERD.
Which is severe chronic acid reflux.
Right. In a patient with severe GERD, the lower esophageal sphincter, which is the muscle valve that acts as a gate keeping stomach acid from splashing up into the throat, it becomes loose and floppy. To fix that valve without doing invasive surgery, doctors utilize an RF treatment known as the Stretta procedure.
And the mechanical details of this procedure in the clinical reviews are absolutely wild.
They really are.
They basically send a catheter down the patient's throat. Once it reaches the valve, they inflate a small balloon to press outward against the esophageal wall.
Yep.
And then from that balloon, they deploy 4 tiny 5.5 millimeter needle electrodes directly into the muscularis propria.
The muscularis propria is the deep muscle layer of that loose valve. And here is where the physics seem to totally contradict everything we just established about tissue safety.
Okay, me.
They deliver 5 watts of radiofrequency energy over 1 minute to those tiny needles. The target temperature for that deep muscle layer isn't 42 degrees. It isn't 50 degrees.
What is it?
The required target is a scorching 85 degrees Celsius.
Wait a second. You just told us that 50 degrees Celsius permanently kills the mucosal tissue.
I did.
But now they're blasting 85 degrees Celsius right through it. I mean, how does the surface of the esophagus not just melt? It's like, I don't know, reverse deep-fried ice cream.
Reverse deep-fried ice cream.
Yeah, think about it. When you deep-fry ice cream, you have freezing cold ice cream on the inside protected by a layer of dough and boiling oil on the outside. But this is the exact opposite. How do they keep the surface cool while essentially boiling the muscle underneath?
It is the opposite, and they manage that apparent impossibility by utilizing a patented concept called the reverse thermal gradient.
The reverse thermal gradient. Okay, how did that physically work?
While that deep muscle is being heated to 85 degrees Celsius, which, by the way, creates a very precise thermal lesion that will eventually heal, scar, and tighten the loose valve, the catheter device is simultaneously pumping chilled water over the surface mucosa.
Just plain chilled water, not saline, because I noticed the sources make a huge deal out of that distinction.
It has to be plain, sterile water. It cannot be saline.
Might not.
Saline contains salt, which makes it electrically conductive. If they use saline, the water itself would conduct the radio waves and heat up.
Oh, which defeats the entire purpose of cooling it down.
Exactly. By continuously irrigating the surface with plain water, they keep that thin epithelial layer safely below the 50-degree danger zone.
So they're actively freezing the surface while the deep tissue cooks.
The Stretta protocols specifically target keeping the surface mucosa below 40 degrees Celsius, and often they aim closer to 35 degrees Celsius.
Wow.
To achieve that, the water being pumped in is chilled to between 0 and 10 degrees Celsius.
That is freezing.
You literally have near-freezing water washing over the fragile surface to protect it, while just 5.5 millimeters underneath, the muscle tissue is practically boiling at 85 degrees.
That is just a staggering manipulation of thermodynamics. But it immediately brings up a terrifying hypothetical for me. If you are blasting 85 degrees into the muscle, how does the machine know the chilled water is actually working? I mean, what if the pump jams for even 2 seconds? You'd suddenly be cooking the patient's esophagus from the inside out.
And you've hit on the exact reason human reflexes cannot be trusted with this procedure.
Right. You can't just have a guy watching a dial.
No, a doctor cannot manually monitor a reverse thermal gradient in real time. The hardware has to take over.
And the hardware they use is incredible. Modern RF devices are built with highly sensitive temperature sensors called thermocouples, right?
That's right. They are integrated directly into the tips of those 5.5 millimeter needles and into the base of the handpieces or catheters.
So they are everywhere.
They constantly monitor the temperature of both the deep tissue and the surface mucosa simultaneously. And the sampling rate, the speed of that data collection, is frankly difficult to wrap your head around.
Give me a number.
If we look at a transcutaneous device like the Forma, which is used for advanced skin and tissue remodeling, it utilizes a temperature sensor that reads the skin surface temperature 1,000 times per second.
1,000 checks every single second. That is unbelievable.
Every single millisecond, the computer asks the tissue, are we too hot?
Right.
And it isn't just looking at the temperature. It is continuously calculating the tissue impedance, which is that electrical resistance we talked about at the beginning.
Oh, right, because the resistance changes as it gets hotter.
Exactly. As tissue heats up and loses moisture, its resistance changes. If the mucosal temperature hits 50 degrees Celsius, or if the impedance feedback exceeds a critical safety threshold, let's say 1,000 ohms, the software instantly, automatically cuts the power to that specific electrode.
I have to ask the morbid question, because anyone listening to this is definitely wondering the same thing.
Go for it.
Why is it so vital to check 1,000 times a second? What is the absolute worst case scenario if the system lags, the power doesn't cut out, and that internal tissue pushes past that threshold? Like, what physically happens to the flesh?
To really understand the worst-case scenario, we
Yeah.
can look at the biophysics data from cardiac catheter ablation.
Oh, they do this in the heart.
Yeah, cardiologists use a very similar RF technology to destroy tiny clusters of heart tissue that cause dangerous arrhythmias.
Okay.
And the physical mechanisms are identical. If that deep intramural tissue exceeds 100 degrees Celsius, the liquid water inside the human cells reaches its boiling point.
The water inside your cells just turns into steam?
It vaporizes instantly. And as a rule of physics, gas takes up exponentially more volume than liquid.
Right.
Water expanding to steam increases its volume by about 1,700 times.
Wait, 1,700 times?
Yes. This massive sudden expansion creates an enormous spike in electrical resistance, followed immediately by an audible steam pop inside the body.
An audible pop, like a miniature explosion inside the muscle wall.
That's exactly what it is. And the clinical consequences of a steam pop are severe.
I can imagine.
The sudden venting of that pressurized steam to the surface of the tissue can cause a physical tear or perforation. In the heart, a perforation can lead to tamponade, where blood quickly fills the sac around the heart.
Which is life-threatening.
Very. And if a steam pop happens in the esophagus during a Stretted procedure or in the vaginal wall during a GSM treatment, you are looking at a severe structural tear.
Wow. So when the manual says the device is reading the temperature 1,000 times a second, that isn't just a fancy metric for the marketing brochure.
No, not at all.
It is a non-negotiable, hard-coded safety requirement to prevent the water inside a patient's cells from flashing into steam and literally exploding.
It is the only barrier standing between a perfect, non-invasive tissue remodeling and a catastrophic surgical emergency. The level of precision is just breathtaking.
Okay, let's take a breath. So, what does this all mean for you? We started this deep dive trying to understand how doctors can heat up incredibly fragile, thin mucosa to heal it without utterly destroying it. And what the sources have shown us is that it isn't just a simple matter of turning the dial down on a machine.
Not even close.
Mm.
It is a highly orchestrated, high-stakes choreography of physics and biology.
It requires managing hyper-precise Goldilocks zones where 42 degrees Celsius heals, but 50 degrees Celsius permanently kills.
Exactly.
It requires wild engineering feats like the reverse thermal gradient, where we freeze the surface of an organ to 0 to 10 degrees while simultaneously boiling the muscle underneath at 85 degrees.
Right.
And it all relies on computer processors reading the electrical resistance of human tissue 1,000 times a second to prevent cellular water from turning into steam.
It truly is a perfect synthesis of biological understanding and mechanical engineering. But before we wrap up today's deep dive, there is one final concept buried in these biophysics papers that completely reframes how we think about applying heat to the body.
Oh, what's that?
It's a phenomenon called thermal latency.
Thermal latency. I remember seeing that term in the research. How does that factor into the procedure?
Well, human instinct makes us think of these RF devices like a light switch or, gas burner on a stove. You turn the power off, the flame goes out, and the heating stops.
Right, if you cut the electrical current, there's no more friction, so there's no more heat being generated. Makes sense.
But thermodynamics in dense biological tissue doesn't behave like a light switch.
No.
No. When the RF energy is completely turned off, the tissue doesn't instantly cool down. The intense heat that was already generated at the target site continues to conduct outward into the surrounding deeper tissue planes.
Oh, I see.
It's like taking a cast iron skillet off the stove. It keeps cooking whatever is inside it long after you take it off the heat.
Oh, wow. That makes so much sense.
Yeah, and one of the experimental studies we reviewed tracked this exact phenomenon. They show that after a 10-second delivery of RF energy was completely shut off, the temperature at the border of the thermal lesion didn't drop.
It didn't drop.
No, it actually increased by another 3.4 degrees Celsius.
Even with the power off.
Even with the power off. And it kept rising and stayed elevated for more than 18 seconds after the machine was completely dead.
Wait, so the tissue keeps cooking for almost 20 seconds after you take your foot off the pedal?
Precisely. Active tissue ablation, whether beneficial or adverse, continues despite the total cessation of the electrical current.
That's terrifying.
It means medical professionals have to calculate not just the heat they're actively applying, but the invisible wave of residual heat that will continue to travel through the patient's tissue after the device is shut down.
That is just wild to think about. It really makes you wonder where the future of this field is heading. I mean, if doctors currently have to mentally map out a 3.4-degree temperature rise that happens 18 seconds after they turn the machine off, just imagine what future medical AI models could do with that data.
Oh, the possibilities are endless.
We could see artificial intelligence using the physics of thermal latency to perfectly sculpt, tighten, and heal tissues in complex 3D environments. An AI could predict exactly how a wave of heat will ripple through your specific anatomy before the doctor even presses a button.
The potential for entirely non-invasive, perfectly tailored structural medicine is enormous. As the hardware and the predictive algorithms improve, we're really just scratching the surface of what energy-based devices can accomplish.
It's an incredible look into the future of medicine. So for everyone listening, next time you have to iron a delicate silk shirt, maybe just appreciate how blunt and primitive our everyday tools really are compared to the microscopic balancing acts happening inside the modern medical clinic. Thank you for joining us on this deep dive into the source material. Keep asking questions, keep looking beneath the surface, and we'll catch you on the next one.